Welcome back to How to Be Patient. This is a throwback episode where we will be delving into attachment theory. It's like our second one ever.
Yeah, I feel I'm securely attached to that episode, and we thought we'd bring it back because we felt like it was a good one.
And I think I was tired of avoiding the episode. So it's about time to challenge that avoidance and come back around. I think that this was kind of a chance for us to figure out how to find our rhythm a little bit as a pod. Like we explored the, secure attachment, anxious, preoccupied attachment, and then the avoidant attachment styles. And I think we went into some anecdotes. So I hope you all enjoy the episode. It's kind of fun to see how far we've gone just in our cadence and how we put together the podcast as a whole. But I think this is one that is a banger.
I feel like since we made that one, that was in my beginning of fourth year when we made it, and now I'm at the end of first year of child. And I just continue to think, obviously, the field of science around attachment, but especially when it was emerging in terms of what we understood about therapy, I feel like attachment science gave a language to what was being described in psychodynamic or psychoanalytic therapy and has given us a thread to follow. And yeah, I just think that episode, and honestly reviewing for that episode and understanding some of these things that are now brought up in common everyday language, especially in child, but also in adult therapy, is a good foundation for anyone to have.
Yeah, if you're going to start somewhere, start with attachment theory. And it's like a string, it follows you. I remember when I was prepping for the existential therapy episodes much later, everything just started boiling down to analogies for attachment. And when you're dealing with your death avoidance and you think that, you're either personally infallible or there's going to be some great rescuer, those two death avoidant denial techniques, they really start to express themselves as either avoidant attachment or anxious attachment. So it you could argue a lot of roads come back to attachment, but it's a really good foundation to have.
This is just making me think of the thing we may have talked about in the attachment episode, but when you're at the eye doctor and they're like, okay, this lens, now this lens. And it's which is clear? It's just this is what we're doing. We're existential therapy? No. This DBT? No.
One
Attachment?
or two?
Oh.
Those attachment? CBT. Well, without further ado, we hope you enjoy the episode and don't get too attached. So, Margaret, how's it going?
I have gotten a lot more famous since we last spoke, Preston.
Oh, okay. Tell me more about that.
Have you ever heard of Strega Nona?
No.
Well, you're about to hear a lot about it. There is a New York Times article about how we're having a Strega Nona fall after Brat Summer. So did you celebrate Brat Summer?
Okay, so you mentioned the thing about Taylor Tomlinson. Is she the one talking about Strega Nona fall?
She's
She's organically coming up on my For You page now. Strega Nona fall.
You're welcome for that.
And all this Strega Nona stuff that I'm hearing about indirectly, all over the group chat, I'm like, oh my God, Margaret's everywhere.
I'm everywhere. So I'm in the Strega Nona-sance, as I have named it.
So can you explain to me what is Strega Nona?
So the start of the book, which is a children's book from the 70s, is that she is Strega Nona, although I've learned online that it's maybe spelled incorrectly in Italian, and so it doesn't translate as it says in the book, but is Grandma Witch. And the primary story most people read when we were younger was she makes a ton of pasta, and she has magic in which she can make pasta for the whole town. And she hires this guy. She gets older, and she hires this guy named Big Anthony. That's the name in the book for him.
Big Anthony?
It's literally every time he's in the book, it's Big Anthony. And he's supposed to do chores, but he sees her one day doing the magic that makes the pasta and thinks that he can do it. So when she leaves to go out and visit her friend, he tries to make pasta, but he doesn't know the secret to make the pot stop making pasta, and then it overruns the town.
Oh.
But then she stops it and she saves the day. And his punishment is that he has to eat all of the pasta that filled the town.
What a punishment.
Which is, I think something for everyone to think about. So
is everyone in Strega Nona fall, are they just making pasta as a way to celebrate this Italian witch?
Yeah, that's what I'm trying to get them to do.
Okay. And you said that the New York Times published this?
Yeah. So I was reached out to on my Gmail that was NYT inquiry Strega Nona.
That's incredible. So the most famous person that's ever reached out to me was someone for BuzzFeed.
BuzzFeed still exists?
It does, and they're in my DMs, and they were like, I'm doing a story on craziest things medical creators have ever experienced. What are like some crazy things from your DMs that are like super crazy that we can include in this wild article? And I was like, stop. Finally, some real journalism.
What was the craziest thing?
I mean, I talked about like all these like unsolicited sexual passes that I get, and I was not expecting that at all. I don't really discuss it because I don't consider my content to be grotesque in any way, but people say some wild stuff. And it was just like a video about me like taking care of my plants or petting Magnolia. So that was my contribution. How many
times have you been offered to be a sugar baby?
About half as many as I've been solicited for feet pictures, unfortunately.
People want what they want. They want what they want.
You know, I try not to think about it. I don't shame it. You know, if you like feet, if that's your thing, that's awesome.
Oh, cat sighting. Speaking of, what
Magnolia,
were you doing?
Magnolia
what, you a recent update?
So, I got a new cat. Her name is Lilac, and I've been like doing the whole introduction with Magnolia and them this week, and it's been going pretty well. I was like, she's tuning in. Actually, I was pretty nervous at first because Magnolia is like super antisocial, and she's like. So back in my old neighborhood, she was known as like the villain cat. Like she has a split face and she's tortoiseshell. She looks like a little spice jar. So people would call her Spice. And I'd be like out with Maggie in the front yard and someone would walk by and be like, oh my God, it's Spice. And I'm like, who's that? And they're like, this is the cat that antagonizes my cat every night. She like goes out into the she goes out into the night.
She's so Strega Nona fall.
And she's like, she's got her little whiskers pressed against the screen and she's just staring at these poor domestic house cats and they're like, oh my God, you know, she's the villain in our lives. And so I kind of realized that Maggie isn't the sweetest cat. So I was worried about like having another cat because, you know, but turns out they're doing okay. Like Maggie just kind of likes to watch and then they bumped noses yesterday and they didn't smack each other.
Is that a good thing or a bad thing in cat world?
You know, you have to ask them.
Oh. I didn't grow up with cats or because my parents are allergic or my mom's allergic. And so I have no idea. When you were like, they can't be in the same room at the same time. I was like, what is this?
Yeah.
What is this?
So going into this segment, I want to talk about your hot takes based on your rotation right now. So do you want to go first? Do you want me to go first?
You can go first.
Okay. So my hot take is that psychiatrists should spend an entire rotation with the radiologists.
Okay, say more.
So I did a month on neurorads and I'm also doing a neuropsych rotation. And the amount of like psych stuff that we actually end up seeing on MRI that just gets like thrown under the blanket of like no acute intracranial abnormality is kind of a lot. And the stuff that they pick up on is really unique. So like, for example, I was looking at a MRI with Lewy body dementia versus Alzheimer's, and there's a distinct pattern in the way that it atrophies. So in Lewy body dementia, bilateral temporal lobes are preserved relatively. The anterior temporal lobes go, medial frontal lobes start to go, and then also the atrophy of the ventricles is like an inside out, kind of like coring the apple from rotting from the inside. Whereas in Alzheimer's, the temporal lobes go first, and the whole thing atrophies.
Brat Summer mentioned, sorry.
Yeah, I think the apple's rotten to the core, except it's your MRI, and I'm sorry you have dementia. But I was like, oh my gosh. So we go look at this person clinically, and let's say they have a temporal lobe dysfunction, so memory stored in your temporal lobe, right? And they can't recall details semantically. And I'm like, oh, that fits with Alzheimer's. But then you ask, and then you go and look and you see the atrophy in the hippocampus. And I'm like, the amount of times that I, as a consult liaison psych resident or something, have asked these recall questions and gotten nothing from it in an inpatient setting, and then looked at the MRI and knew nothing about what was going on or the CT. Right. But then there's like more to it. So if I ask someone a question, like, remember this word cloud, for example, and I ask them in 5 minutes if they remember it, and they go, no idea. If I say like, hey, the word has something to do with the sky, that's called a semantic cue. So I'm giving like a part of that schema, I'm giving them a detail. And if they can recall that, that means the white matter tracks are intact and they're consolidating it. If they can't recall it from that, if I give them multiple choice and they can't recall it, that means the memory never got stored.
Yeah.
And so if you correlate that with hippocampal atrophy, you can diagnose dementia, or you can get pretty close.
Right.
And so I was like, wait, why are the neurologists doing this? This is straight up psych stuff.
Well, I mean,
You know?
I feel like the distinction historically between psych and neuro is becoming more and more tenuous as each year and research advances. It's like, why does neuro do it? Like, I mean, like we know that like post-stroke depression is a thing and is not just like, oh, psychologically someone's not coping with it, but probably is related. And like we know this with any of these. So it's like, well, when shouldn't in the future are all psychiatrists and all neurologists going to be neuropsychiatrists? Like,
I mean, I think that's where it's going. But unfortunately, I think people are pretty attached to these labels.
which makes sense. I mean, I think it makes sense to be attached because like there's such different kind of worlds that you go. I mean, both of us are not neurologists. Like, I
Correct.
know you thought about it. I did not. And I was like, I want to do psych because I want to do this, this, and this. I will say I've like really enjoyed actually like being taught how to incorporate it into psychiatry.
Mhm.
But I feel like the set of things and the set of people that you interact with when we like are in med school of like, what does a neurologist do and what does a psychiatrist do are so, so different for some
Yeah.
reason.
And while we are attached to these different titles, I think now is a good time to move into our topic for today, which is attachment theory.
Let's do it.
So what do you know about attachment theory? What does this mean to you?
So I want to, before we even say any of this, I want to give my first of many caveats, which is that we are both trainees. I know people know this, but that this is our first discussion of kind of like content. And so both Preston and I are going to be reading and are in training. We're also still learning, which I think makes the conversation interesting and also kind of like closer to the point where people are, where they might be listening to this. We will cite things, we will include it at the end, but listen to what we're saying, take it as you will, and then look into things yourself.
Yeah, and this is meant to be a dialectic discussion. I'm not approaching this as a clinician. It's really just Preston and Margaret talking about the things that are relevant to our education and also interacting with people as humans or anyone who has to interact with a person, I guess.
Yeah.
So if you're on Mars and you don't interact with people, then go ahead and turn the pod off. It's not for you.
So I think in terms of attachment, like the first thing I think of when I think of that is like all the TikToks I'll see about people being like, I have anxious attachment, or like when you're dating, like avoidant attached, blah, blah, blah. That is like the first topical thing that comes to my mind.
And they add no context to it. I remember watching those and being like, okay.
Yeah.
Like, what is this label?
Well, and it's like, here's 5 signs that you have this. And it's like, I love pathologizing normal emotions. I think that's awesome. What do you think about it? What is your first
5
response?
signs you have anxious attachment? And it's like, when you get broken up with, you're sad. And everyone's like, oh my God, me. That's so me-coded.
So me. Is there a way to fix this?
And then the next one is like, you miss your parents. And they're all like, whoa.
Whoa.
Yeah. So when I picture attachment, I don't know why. I don't go to those TikToks. I just picture a monkey clinging to its mother as she's climbing through the trees.
I feel like that's like a good image to start
Attachment
with.
theory.
Yeah.
You know? I'm like,
Yeah.
Like, or like when, you're like a toddler and you'd wrap your arms around your mom's pant leg and you try to walk and you just turn yourself into this cumbersome ankle weight.
Yeah. I think that's a good place to start. And I think in contrast to what I was like thinking of in terms of like the TikTok stuff is I don't know how much people actually know. I don't know that I've been taught about it actually yet in terms of outside of my own reading in like residency.
Yeah, I think everyone that I've talked about it with just kind of acts like they know what it is. And then they're like, oh, yeah, I've been on attachment theory. And then you ask them about a detail of it. And they're just like, oh, the one where you're attached and you don't like being unattached. You're like, oh, okay.
When you do things funkily. I think it's also like there's so much even in psychiatry, which is a specialized field, right? Compared to like primary care. In that there's so many different lenses you can look through and you could read forever on like each of them and ask questions and like never fully understand it. And I feel like attachment is kind of something that is now sort of foundational both to like development as well as like how we think about therapy or how we think about like relational health. But how do we actually kind of go with a critical lens and look at like, where did this come from? Why did it emerge like historically? And also, what can we say it actually is helpful for or not? Because like any diagnosis or tool, if it's like not correct. Like people can use it and it can be helpful in their lives, or it can feel like a box that they're trapped in.
Yeah, I think how I approach all these different theories is they're just ways of organizing the complexity of human interaction. And attachment theory captures part of the self, it captures part of the interpersonal interaction, but it's just, like you said, is one lens. We're all trying to use these different theories to categorize the same basic thing, and we're just looking at it from different angles. So it sounds like you have some hot takes about when this theory first started. I don't actually know that much about the origins of attachment theory.
Yeah. So I always think this is actually an important place to start, even when I'm talking with my patients about it, just because I think so much information and misinformation is out there. So attachment theory is the kind of parents of attachment theory are a guy named John Bowlby and then Mary Ainsworth. John Bowlby was a psychiatrist, I think, or he was a psychologist in like the 1930s and 40s and onwards, who was trained, as so many people were at that time. The primary model of understanding people's like mental health and responding was psychoanalysis. Like that was kind of the only game in town. And he was under this, what I read is like he was under the study at one point of Melanie Klein, who is a famous like psychoanalyst after Freud. And
This is like the 20 years after Freud's come to fame, and everyone's
correct.
just
Correct.
psychoanalyzing, paying $50,000 to sit on a couch and talk about their dreams. Okay.
Yeah.
So the scene is set.
The scene is set. So he had a lot of really kind of new theories at the time that were somewhat divergent from what the main like psychoanalytic thinkers were saying. But he was more of a theorist than he was like someone doing empirical clinical research until he started working with Mary Ainsworth, who was more of like a behaviorist clinical researcher. Mary Ainsworth is the one who did the thing that probably all of us who have read anything or ever had a lecture on attachment have gotten, which is the like strange situation experiment.
Oh my God, I remember the strange situation.
Yeah. What do you remember about it?
Is that the one with the baby? So they they put the baby in the room and then they run away from it and then they come back and see what it did, right?
Yeah.
Oh, no. They have a stranger come look at it too.
Yes.
So there's a child in a room
Mm-hmm.
and he's playing with toys and mom's like, oh, hey, how's it going? And then mom leaves and a stranger shows up and just like stares at the kid.
Yeah.
And then the stranger leaves and the mom comes back.
Yes.
And then they see what the kid does. So like sometimes the kid is like, oh, thank God you're back, mom. And they're like stuck on her. Or sometimes they like pretend mom never left, right?
Mm-hmm.
That's that one. Okay, sorry, keep going.
No. That's it. And so there's all sorts of things we could say about those studies, but in the interest of time, there was some importance in terms of like how does the infant, it's like an infant that can like crawl and point and interact. So it's like, get up in the months up, in that kind of, think of that age range. And they would exactly what you're saying. They would have the mom there. They would have the mom leave. It was in a lab. So it's also like a strange environment. And then they would have a stranger there. Stranger would leave. Mom would come back. One of the interesting things I was reading was that it ended up sort of being, in their view at least, more important to what the reunion was like than anything else. Like there is some importance in like if they leave, how they react, but like how is kind of the connection reestablished when there's been like a small breach. And
like,
so
can you heal like an airplane? If it hits turbulence, can it restabilize?
Yeah, exactly. And I mean, if we think about adult relationships, like if you have a fight with someone, can that deepen the connection rather than rupture it? So that is kind of the foundational research that showed like there's sort of three styles of response that the infants responded in. In those studies, they called it ambivalence, which I think we think about as anxious, sort of, avoidant, and then secure. And then eventually after that, when there was more studies later on, there was kind of this question of like disorganized or like a sort of mixture of styles.
So was this only where I get kind of confused is that attachment theory is between adults when we talk about interpersonal relationships, but all of these studies back in the 70s were between like infant and mother. Did they make all these like big jumps assuming that your ideal relationship with your caregiver was like established as an infant and then you just carry that through the rest of your life?
So those jumps are still in my reading, my understanding, are still up in the air. So I think that it's interesting in that, like, I think we can say things about adult attachment and like adult relationship forming in the literature. But I think one of the things that I don't know if it's a hot take, but is like, how sure are we that this totally applies in the way that it's like now commonplace to talk about in terms of attachment? And I think it does, but I think sometimes like many like things or many like much good science, we get like some stuff right, but then we want it to all be one cohesive answer and the science
golden
from there.
bullet.
Yeah, exactly.
Oh my gosh, yeah.
So that's kind of like the history, and then there's been like different things of how to apply it to adults that came through in like the 80s and 90s. Like, don't get me wrong, I think there's a lot there that is kind of proven and known, but I think these kind of like bullet points, oversimplified sort of archetypes, and the finality of them is the thing I like take issue with, because I think it's oversimplified and can trap people.
Yeah, I think in a lot of ways we Myers-Briggsified attachment theory and just kind of turned it into this like pop psych, almost corporate jargon that people can use.
Yeah.
But there is, I think, utility to it outside of even like the love language concept of stuff. So the way I think about it now is that there's a couple different types of attachment, right? I guess. So can we start with the stable kind, the kind where if you go through the turbulence as an airplane, you can correct back to normal? What's that one called?
Yeah, so like talking about secure attachment. And I think it helps to ground us in like, what is the secure infant attachment? And then talk about what that might look like in adulthood based on like the literature, but also based on like how that kind of relates. So, the kind of secure,
the comfortable infant, that was fine.
Yeah. So like the secure infant would, one of the kind of key concepts in attachment at that time, like during Mary Ainsworth and John Bowlby's work, was this sort of idea of like a secure base, so that like the parent, when they come into the room and they're there and they're establishing like before the mom has left in the settings, which also obviously that's a caveat because men are also parents and can form attachments with their kids. But this is in the early studies, their ability to kind of like come back to the parent and see that they're there. And from an evolutionary perspective, right, like to know that they are within like the reach of their caregiver to be able to survive. But then when that's there, an ability to explore. So this balance of safety and being able to explore and discover.
So I'm safe on my own to take this risk. And also I know I can depend on mom to come get me if I need her.
Yeah. And I know that she's there.
And I have that ultimate trust in mom, and I have that trust in myself. And that's how my framework of the world.
Yeah.
Okay.
And so when the mom would come back after the strangeness, there would be it would be quicker for the infant. Like the infant would reach back towards her. The infant would be generally like more consolable and interactive and like snuggling, but then eventually would feel safe again to go explore and not like cling too much like to the parent.
Okay. So just like we talked about, return to mom, they're consoled and they're like ready to explore again.
Right.
Okay. Well, that sounds pretty secure to me.
Yeah.
All right. Stable. So now what does it look like when they're not stable?
Yeah. So the terms used at the time, I'm going to switch to just saying anxious attachment, but it was like the term was ambivalent at that time in the earlier literature.
And so all of these just fall under the insecure attachment.
Yeah, so the two non-secure.
Okay.
So the anxious attachment or the ambivalent attachment, same thing, would sort of when the parent would leave and then would come back, there was more of this like inconsolability as well as like the like clinging on, not able to go explore, kind of more like difficult to repair the kind of, but not betrayal's too strong a word, but like to repair like, okay, I am safe and renew that sense.
The abandonment caused an injury and the return of mom isn't enough to close that wound.
It was interesting because on the avoidant infants in some of these studies, it was like, it looked on the surface like they were kind of just calm, like a duck, like calm on the surface, and then underneath they're like kicking their legs like crazy. And their blood pressure, heart rate, and like cortisol would be rising when mom was outside the room despite the kind of stone face. And when mom would come back, they wouldn't like rush to her. They wouldn't kind of retach. They wouldn't show
so
upset.
I'm confused. This is the anxious attachment, or is
This
this
is
not
avoidant.
this is not the avoidant? Okay.
Yeah.
So they're pretending I don't care, but they really deep down they probably care based on us measuring their sympathetic response.
Yeah. Or they've learned kind of like re-seeking attachment doesn't get me what I want. Like it doesn't get me a further sense of safety. So why would I waste? So I'm still distressed that caretaker is not here, but there's a little bit of like a learning probably in terms of like why pursue that.
Gotcha. So it's like this makes me think about operant conditioning when you're like modifying someone's behavior. So these avoidant kids, or I think avoidant people in general, have kind of learned that their caregiver is reliably unreliable. And that if they can count on mom for anything, it's to never show up. So I have to rely on myself. And that trusting, like, other people are bad and I'm good, basically. Like, the only person who's going to look out for me is me.
Right.
Even though it still stresses me out. And then I guess the anxious attachment ones, how I understand, it's this variable interval reinforcement. So you know how like with a rat in a Skinner box, if you give it the cocaine laced water every fourth hit, it will constantly go to every fourth hit and then eventually give up. But if you randomize when the cocaine laced water goes through, it will tap the Skinner box relentlessly until it passes out. And so when mom is disorganized and she's not responding, like maybe she has her own stuff going on, she's on the phone, she's busy, who knows, she has her own traumas, then the kid is getting that variable reinforcement that when they seek attachment or they seek help from mom, they get it randomly. So they are just asking for it constantly, just like the rat, but they're saying like, hey, I need you, please help me.
Right. Yeah, I think that's exactly right. And I think also in the, like with Mary Ainsworth, like the history, I think from her work and just in general was like the strand of the behaviorists like Skinner of like, how is this like ways of understanding more observable behavior versus like psychoanalysis was sort of like these invisible desires and what was driving people, both of which I think have validity. But yeah, you're exactly right. I think that's the way they started to make sense of it too.
So now like in adults, we have this kind of same idea. So the securely attached adult, I imagine, has a positive view of themselves and a positive view of other people. Like, I'm okay on my own and I'm okay with another person. Like, other humans are safety.
Yeah.
And I am safety.
Yeah.
Is there anything else to like the securely attached adult?
Yeah. I mean, I think in my view, and this is sort of anecdotal now, like there's also this similar to with like the infant that like one of the main things was how does repair happen and can repair happen? To me, a secure adult, you know, in terms of attachment is exactly what you said, as well as like when like knows that relationships won't be perfect and there'll be fights and misunderstandings, and is it able to tolerate that and has skills to be able to repair and have enough kind of space without feeling really, really scared or like overwhelmed to build closeness over time, which includes conflict and repair.
So I'm not afraid of conflict and I can be consoled with conflict. Yeah. I think one thing that strikes me in well-adjusted and secure individuals is this thing called object constancy.
Yeah.
It's like object permanence, where you play peekaboo with a kid. When you cover up your eyes, so if something's visually obstructed, can I still comprehend that it exists behind the curtain?
Right.
And object constancy is like that, but just for emotions. So if I'm feeling an emotion towards you, can I comprehend that my other emotions also exist towards you? So like Margaret, am I capable of being mad at you right now, but also know deep down I like you? Or maybe I'm feel skeptical of you, but I appreciate this gesture you did for me right now to like a stranger on the bus or something. And I think some people have trouble holding those emotions in tandem.
Yeah.
And so it kind of leads them to either I'm going to reject this person completely or I'm going to attach to them.
Yeah.
solely. And also one thing I guess I work with a lot of my patients on in therapy is being able to see the complexity of emotions in a situation. So if something happened,
Love that.
it's not all bad or it's not all good.
Yeah.
And if you can almost like they're vectors, I guess, like arrows. So if the only arrow I have is just like bad when something happens, then like the situation is crisis. You know, it's not just, oh, you know, they were mad at me. It's like, we're going to break up right now. But then if you have, oh, well, like at least it feels comfortable expressing herself in front of me, but also I feel sad that the thing she brought up was that she didn't like an action I did. Now, like you have one arrow pointing up and one arrow pointing down and you're neutral.
Right.
So that also kind of tempers how much this conflict like destabilizes them. Yeah. So I think securely attached individuals, they're secure at the beginning, but also it's almost like they have shock absorbers in the way they interpret the situation. It doesn't just go 0 to 100.
Yeah. I always like ask my patients, when my therapy patients in particular, I ask them like, when we're talking about how they handle emotions or how they deal with like things that are making them anxious in relationships, I always ask like, hey, what was your role model of what to do with hard emotions or what to do with conflict? Those are two separate things I'll ask. But like, I think similarly with attachment, it's like, how are you taught how to deal with, like, our parents teach us how we deal with these like hard parts of life. And, you know, are you taught? So one of the things that they talk about in the studies, the earlier studies, was kind of like the attunement. And the other term.
What is attunement?
So attunement in this case, but also actually I think in most cases. So attunement is kind of the ability for another person in the studies, like for the mother, to read and respond to the infant's needs and emotions and distress. So
like how calibrated is the mom to the kid's cues?
Yeah. So
one of their emotional or physical cues. Okay.
One of the things that is talked about a lot in therapy in different ways is like the idea that of like the good enough mother, which was kind of a pushback against like our parents do all these things and they mess us up and and like especially on mothers historically. But one of the things in the attachment studies that they started to think about was like not the quantity of attachment kind of actions, but the quality of the attunement in them. And so attunement, when we practice it as like therapists, to talk about like adult attachment style, but also to talk about like how does this come up in therapy, is it is important that we are reading our therapy patients like correctly and responding to them in a way that is like attuned to what they need and is not like shutting them down or like exacerbating it.
So like, because if I express something to my therapist, I want them to have an idea that my emotion is being shown.
Yeah.
So like if I guess if I'm crying, it even just as simple as a statement of like, hey, I noticed that some tears came out when you discussed that this is important to you.
Yeah.
Or like, I noticed that this seems to make you upset. I think when I'm in situations where I've expressed myself and I don't think any emotions or like my emotions are acknowledged by other people, it's almost like my emotions don't matter.
Right.
And I think that there are some kids that grew up in households where their emotions were almost never acknowledged. It's funny you should say that. I think I remember seeing a study that looked at the latency between when a kid would express something and how quickly the mom would react to it and if she reacted appropriately. So like, let's say a kid was crying. How long does it take mom to go and say like, oh, are you sad? Like, let me acknowledge that you're sad. Or if kid's happy, are they happy? But if it's like disorganized, like if you're crying and mom starts laughing at you or something, then you're like, wait, if I'm expressing distress, why is this amusing to this other person? And so you're trying to calibrate how do my personal feelings relate to other people? And this is like my starting block. This makes no sense.
Right.
So to kind of like reattune people in therapy, you have to show them like, no, I'm noticing this emotion. This is how I respond to it.
Right.
I'm noticing that you're excited, or I'm noticing you're angry, or frustrated, or sad, or despaired.
And I think that that's like, right, like emotional experiences in relationships, despite like what kind of pop culturally I think we say and are taught, at least in like the US, are still things that are learned. one of the things that Bowlby would talk about is like the internal working model is like the kind of way he would phrase what we learn from attachment as kids and what we take into older childhood and adulthood is like this model of how relationships work, what emotions mean in us, and which touches on a lot of the things, right, that you were taught we've talked about already. I think with that, maybe talking about like what do you think about when you think about like an adult with like a quote unquote anxious attachment style in a way that isn't, like 5 bullet points, but is like, how might that show up?
I think about someone who's this serial monogamist. They almost have to be in a relationship, and they have this kind of codependent organization. Like almost this like uncertainty of making a decision. Have you ever met the type of person, and I think this was me for a lot of my life, they can't make any kind of decision without having the endorsement of like everyone around them. Like, hey, does anyone want to like go out to this amusement park this weekend? Or like, I'm thinking about going to this college. Like, what do you think about it? What do you think about it? What do my parents think about it? And then there are other kids in high school that were like, I'm going to this university and I don't care what anyone says.
Yeah.
And I think classically, I think of for the avoidant kid or the adult, I think of that like person in the back of the class with like the alpha lone wolf t-shirt,
Well, can we?
They're like inside me. There are two wolves
for the podcast,
and neither of them needs the support of a relationship. No, it's seriously. I've talked to people and they're like, I really like my independence. I couldn't imagine being tied down in a relationship. They use all this negative language to describe a romantic bond between people as though it's something unsafe. And the other thing that I find interesting, so when I read about it in adults, there's this, I guess, a fourth type of unstable attachment.
Yeah.
And that's mixed, or I think disorganized.
Yeah.
Or fearful avoidant, are all terms I use. And that's where you're basically the best of both worlds. So I think
Montana mentioned.
Yeah. I think about 60% of people are securely attached, and then you have 20% are anxious, another 20% are avoidant. And then the scraps. The 55%ish are secure. The last couple percents, like 1 to 2%, those are your feel for avoidance. It's less common, and because it's kind of hard to develop that organized view of relationships. So someone who's fearful avoidant, because they're both, they have this anxious codependence, but then the second they get close to a relationship, they're afraid of it and they push it away. So you crave emotional intimacy, but you fear losing your independence. Which sounds like a nightmare.
Yeah.
To be stuck. Like, I feel like you are almost like never satisfied.
Yeah.
I guess we've kind of seen how these exist on different lines, and everything is on a spectrum, I guess. So
I think one caveat to mention though is that like these are ways of relating that people learn, and therefore they don't silo quite as neatly as how we're talking about them. I think they're super helpful and valid frames to think about, but I also think like the mixture of styles, or that people can act differently in different relationships. I think one of the things that bothers me the most about like attachment style stuff talked about online is when we give people this as like a framework, and we talk about like the emotional, like emotional, physical, or any other like abuse world.
It becomes the prison that they view everything in their life.
Well, and it becomes like, if you feel anxious and you're not sure about the person, like if there's gaslighting and there's emotional manipulation and there's like infidelity or abuse, anyone would feel uncertain, right? Anyone would feel that. So just to say that these don't happen in a vacuum when you're an infant, and they're in a dyad always, or they're they're the thing you create together. And so while people may tend towards relating in a certain way over and over again, it's also like people will get into, one of the papers I was reading was talking about like people with anxious attachment styles, if they get in a relationship where they feel sufficiently attuned to, can have really good relationship outcomes. And so just that it's not just one person playing at any time. And that also this is a different conversation if like abuse or just any sort of abuse is on the table.
Yeah, I think we, as a society, especially in pop psych, struggle drawing the line of pathology. And I think I always use I always like fall back on physical pain as my metaphor for this. If I step on a nail, it's gonna hurt really bad, but that doesn't mean I have chronic pain syndrome or someone that experiences like unrelenting chronic pain every day. And I think we do the equivalent in psychiatry of I step on a nail one time, I'm like, oh my God, I have chronic pain syndrome because my foot hurts so bad.
Right.
And everyone's like, well, it's like kind of, this is reasonable, but it's not disrupting your ability to like engage meaningfully with your life. And I think it's just so hard for people that like once they identify this emotion to say like, oh, it has to be pathology.
Right. Well, and I think similarly, like with acute and chronic pain, one of the things that we know in the chronic pain world is like there are certain things in the way you view and relate to pain that like if you have acute pain and you're really anxious in general, and you're like, oh no, what if this turns into chronic pain? Is this chronic pain? You are in some ways more likely to develop a chronic pain syndrome. Similarly with attachment or with emotion, I think, in a lot of ways, if you are really fearful that it means something big and bad is wrong with you and your life is like effed forever,
this is my soulmate or I'm doomed for the rest of my life.
Right. Or this is my attachment style because some of it resonates with me. When in reality, is it your attachment style or are you just normally anxious because you're like going on a first date?
Yeah.
Does it have to be pathology or can it be human experience and can we not be emotion phobic, which our society also is?
Exactly. Like CrossFitters. They say pain is weakness leaving the body. Can we get a reframe on my anxious attachment? Like, oh, this is
Can we get a reframe, please?
this is my insecurity leaving the body. Yeah. And there's like this whole community like, yeah, embrace your insecurity.
CrossFit Matt mentioned.
No, it's funny because I think like I've seen people that like they love CrossFit and the way they appraise pain, they like lean into it. Where the other people are like, pain's the worst thing ever, I'm trying to avoid it. And they're like, if I don't hurt, I'm not having a good workout. So and like ideally people are experiencing the same sensation, but they have a very different relationship with it. And I think even like I'm the same way with grief. Is one thing I'm trying to do is like I know people that they will like lean into grief and be like, I'm so sad and I feel this. And other people like me will be like, I never want to experience grief. I'm going to find a way to replace this emotion or avoid it or do something.
I'm going to delete this emotion.
And so I don't know how to be that CrossFitter who's like, oh, this is like strength entering my body or weakness leaving my body.
I also want to say like that the CrossFitter also like, right, the person who does that also is more likely to, is an issue with injuries in CrossFit and pushing yourself in that way that our brains really like
toxically positive.
Yeah. Or like it can be that there's too far in both directions. And our human minds love to be like, I have one rule and I apply it to everything. And now I can turn off in some ways because I don't have to make complex decisions anymore. I don't have
to critically think because it's who I am.
I hate critically thinking.
Yeah.
Let's get rid of that. That's my hot take.
That's good. I'm glad we got around to your hot takes. So when we come back, we can go over this attachment quiz that I took. And
he sure
the results kind of, they surprised me because I didn't think that my childhood was that bad, but I guess we'll find out. And I also kind of got to see that continuum of how it scored me in multiple regions rather than just being like, here's your single label, here's your gold star. It's like, no, you actually, I got my little like equivalent of like ENTJ, which that's my Myers-Briggs is ENTJ. Or I think it's INTJ. I'm like somewhere in the middle. Okay, so we'll take a quick break, and then when we go back, we'll talk about our own attachment problems.
Well,
or mine. I have my results.
Let's hear them.
I was kind of surprised. I thought that I was this paragon of human emotion and interacting with people, and then it said I was 60% fearful avoidant, or the mixed disorganized.
You're a unicorn.
I know. I was like, I got the rare one, and then my next one was secure. So I was like, okay, we're in the bag there.
What do you mean your next one?
So it kind of ranked me. Yeah.
Answers.
So my highest one was fearful avoidant. Then it went secure. Then after that was anxious, and then the last one was avoidant. So I think what's interesting about that is it kind of implies that I have this almost negative view of myself and a negative view of other people. So it's like I don't trust myself to be quiet on my own, but I'm also like don't trust myself to be in a relationship with someone. And I was like, how does this actually like manifest? Like does this like make sense with like kind of how I was raised? I don't know. And so I was debriefing this in therapy, and I think a lot of it came from how I got a lot of mixed messages from both of my parents. So my dad, I always joke that my dad's love was like an electron. You know, like you're pretty sure it exists, but you can't like see it, feel it, touch it, taste it. You know, you're like, who knows? You know, but like I believe in like quantum mechanics and I know it's there and he must express it, but like I'm not experiencing that. So that was kind of like one relationship I had where I knew not to trust someone else. And I was like, okay, like I have to be on my own. And then my mom would give me a lot of support and would be very intimate and kind of like emotionally like lovey-dovey, but then would also kind of flip the switch and yell at us a lot. Like like one time I had like a relationship over for Thanksgiving, and she like screamed from the top of the stairs. She was like, "Preston, like get your laundry." And dude, like I'm a medical student. Like I'm like 25 home visiting. And then the girl I was with was like, "Your mom yells at you like that?" And I was like, "Yeah, I'm used to it." And she was like, "My parents never yelled." And I was like, "Oh, well, this is nothing compared to what it used to be."
Like, this is actually the good edit right now.
Yeah,
this is
like,
not the behind the scenes cut.
I'm chilling, yeah. And so she was like, "Preston, I think like you kind of had a more toxic childhood than you thought." And I was like, "Oh, okay." So then I took one of those like ACEs, adverse childhood experiences, and I was like, "Oh, okay, whoa." There's a significant amount of these, yeah. And I guess it kind of started to make sense that I was like, I don't know if I should be able to express myself. And funnily enough, humor is like one of the ways that I learned to like avoid those situations. So I would always like diffuse situations in the household by making a joke or being funny. Or I would like, I almost view like shame or like being silly like a vacuum. Like all the eyes can be on me, so the conflict will have to stop. You know what I mean? So like if I had a campfire going and I lit a bonfire next to it, the oxygen's going to snuff out the campfire because it's all going to get taken up into the bonfire. So I would kind of view it like that in my household. Like if my parents are fighting or if there's all a conflict between my sisters or something's directed at me, if I make someone laugh, I can disarm them and I can avoid that like conflicting situation.
Right. And there's also something to that of there's kind of an implicit like, I'm okay, like I'm laughing, I'm happy, I'm whatever, that is when used at certain times that call for like disclosure or vulnerability or sadness, a way of protecting ourselves in the situations where we learn it, like what you're saying of like having to do it. And then though we get into adulthood and maybe hopefully like away from those situations and we push away people who want to know the other parts of us. Because it's like, why would you do that? Also, you might just like yell at me if I tell you.
Exactly. And I think in a lot of ways, I use humor almost as my like fearful avoidant tool sometimes. Like jokes, like laughing together with someone can make you feel close, but also you can use humor to not let someone get too close. Like everything's a joke. I'm not going to let this be serious right now. So it's like simultaneously an icebreaker and it's an ice wall, I guess, if that makes sense.
Right. Yeah.
And I think I feel safe in that environment. So it's been kind of interesting to reflect on that. And that's one thing I'm actually working on in therapy right now is that I use humor as like an avoidant technique. And I always like framed it as positive. I'm like, oh, if I'm making a joke, then I've succeeded. I've diffused the situation. And then my therapist is like,
I'm sad.
She's like, do you ever think you use humor to avoid emotions? And I was like, oh.
Now that you say that.
I was like, this conversation's over.
This
and
is
then,
done.
And then
We're
she
done
laughed.
now.
Yeah. And I was like, see, I made you laugh. And she was like, yeah, I see what you're trying to do. You're trying to avoid talking about this. So
Yeah.
she's kind of got my number, unfortunately. And I've been trying to kind of like appraise when I use that. So I think that's like kind of a driving factor in how I developed this fearful in organization. So I'm not going to go into any of the TMI relationships, but I think it's been helpful to kind of reflect on understanding that you can be okay on your own and also like be stable in a relationship with someone. And I think like the awareness of that is really helpful.
Yeah. There's this like conversation on TikTok right now that is sort of, it's not necessarily about this, but I think it's really related in some ways, in that there's this conversation, at least on my side of TikTok and in kind of like girl world to some extent, of like people asking different people asking this kind of question of how do you be more confident, and like a response generally being like, I think you just need, like, I think you're thinking about yourself too much. And to me, like the C.S. Lewis has a quote that he said, like, humility is not thinking less of yourself, but thinking of yourself less. And to me, that applies to like the attachment stuff too, because it's not like thinking more of them or thinking more of yourself. It's actually like, I will care and I will grieve if I lose this person, but I will still be me. And that's such like a beautiful stance to have in the world. And that like people can become more that way, even if you don't have that attachment style or that experience before.
I think especially, it's funny you should say that. When I was like in my adolescence and I felt like really unstable in these relationships, you know, and you ask that person, they're like, do you like pancakes? And you're like, is Sarah going to like me more or less if I say I like pancakes? You know, and so that overthinking about trivial preferences, like thinking too much about yourself. But if you just kind of answer like, yeah, I do, or I don't, like whatever. And knowing that that's who you are and that will either be accepted or rejected, and that's okay.
Right.
Is really interesting to me.
And that no one can love you if, like, no one can really know you intimately and closely if they feel like you're kind of shifting under their gaze to be something that they want. Like that there's some kind of inherent edge that is attractive of being.
You're trying to filter yourself for their approval.
Because then they're like, well, but who are you? And how can I know you? And how can I trust you that I can be myself with you if you won't be yourself with me? But man, it's tough.
Because,
it's tough stuff.
Worried that, and I think that person is worried that their true self is not good enough.
Yeah.
That if I reveal my true self to this person, they'll find it wanting.
Yeah.
So I need to recalibrate, or I need to kind of almost like mold myself in a presentable way and be the version that they might accept. So like what C.S. Lewis said, think less of yourself, think less about yourself to think more of yourself. It's almost like you don't have to think about yourself at all. You just have to accept who you are.
I think you also have to practice. And this moves us into this, the thing we'll end on, which is kind of what I like the word you used of like recalibrate, of like, what do you think about for you from anecdotes, like outside of clinic or in clinics, of how to make this concept not just a diagnosis, but a workable tool? So I think one of the things is like I'll often ask my patients, even when we're talking about all these other things, it's like, well, what did you like to do when you were a kid? And can you do that for 30 minutes this week and not have it be for performance or not for anything else, but just like re-explore, like, what do I like and what does it feel like and what are the experiences that I can focus on rather than focusing on if I'm good enough, if they're good enough, if this is working.
Yeah, I think there's a lot of beauty in practicing. So one thing we're learning in CBT right now is that if there's ever this discrepancy between how you want to feel about a situation and how you react to that situation, a behavioral experiment or practice is the best way to resolve that. So if you're like, well, I want to accept myself, but whenever I feel like I'm being vulnerable in front of someone, I get nervous and I filter it out. So just like someone who's afraid of a spider, they're like, I know I shouldn't be afraid of this small tarantula or this bunny. I have bunny phobia, but my heart rate's at 150 every time I pet a bunny. You know, it doesn't make any sense to me. And I rationally know I shouldn't be afraid of bunnies, but here we are. The solution to that would be we're going to go pet a bunny.
Yeah.
And we're going to sit with it. So
we're doing bunny yoga.
Exactly. You're going to test out the depth of the pool with both your feet.
Mm-hmm.
Just kidding. We can do a toe in my office. We'll just look at videos of bunnies.
We're just going to watch bunny videos. This is for the patient or for Preston.
Yeah. And then I'm like, hell, another day of watching bunny videos in my office. I'm like, this is another, the patient comes in to talk about their divorce. And I'm like, oh, another classic case of bunny phobia. Guess we'll have to watch more bunny videos.
Symbolic.
And the guy's like, oh, I'm not mad about it. Like, okay.
You're like, well, Easter's coming up pretty soon, so we gotta get to work.
This is giving me serious bunny phobia vibes. Man, we need to work on that. So the same thing with expressing yourself emotionally.
Mm-hmm.
You just
talking about practice.
Small at first, trivial stuff. What's your favorite flavor of ice cream? What's your favorite color? And then, how do you feel about your place in the world? What do you want your career to look like? Like, what do you want another person? Like, those are really strong, vulnerable things to share.
Mm-hmm.
And you kind of get used to be like, well, oh, I shared this thing about me. And then you open the blast doors and you're like, wait, you still like me?
Mm-hmm.
You still accept me? I can accept me? Look at that. So I think one thing that's helpful, like you said, using attachment theory to interact with your patients is to take this as a framework and say, okay, how do you, this complex, nuanced person, at this moment in time fit into this framework?
Mm-hmm.
And then how does it guide us to help close the gap you have between how your life is and how you want your life to be? Because that's ultimately the goal of therapy. It's the goal of psychiatry, really.
Well, and that's one of the roles, too, of therapy and psychiatry. Like, even one of my favorite papers that we have to read every year in my residency is how not what to prescribe, which is kind of on the meaning of medications and the therapeutic relationship and all sorts of things. But the therapy itself is practice as well. And it's a practice of connecting and hopefully connecting with someone who you feel like is understanding you, is listening to you, that if, they do something that annoys you or you feel misunderstood, that there's enough space there to have them reattune to you and to do the kind of small breakage and repair in a way that's different than your internal kind of working model that you've had before.
Yeah. I see it almost you're always going to see me going back to the physical pain analogy. If I broke my arm and I know how to cope with it, I kind of just hobble around and maybe I only grip my pencil with my middle finger and part of my thumb. But then when I go into the physical therapist's office or the surgeon's office, it's going to be really painful to try to do a closed reduction. But that's a safe, sterile environment to do it. I'm not trying to reduce my arm in a Wendy's parking lot with my whole family around. You know what I mean?
A Wendy's parking lot.
I don't know. Maybe
Wendy's, if you want to sponsor us, I love a Frosty. That's all I'll say.
Maybe your hands were full of Frosties and you trip over the curb. Next thing you know, your arm's broken. Now your whole family's around and you're like, oh my gosh.
And you drop it.
How do I handle this? Yeah. So you have to kind of find the right environments to do emotional surgery the same way you do physical surgery. And otherwise it might be too painful and you might just reject it and be like, you're never touching me again. Don't touch my arm.
And again, similar to physical therapy, that takes a long time to make you feel better. And it works, but it's okay, I guess I'm going to the physical therapist's office twice a week and I'm going to be doing my set of bridges and the kid next to me who's 8 is going to be better at than I am. This is not a specific experience at all of mine. But similarly, it's going to take time to kind of reshape the way of relating. But the really hopeful thing is that it's possible, because I think often there's this message of it's either this or that and then you're done, where there's actually a way of changing what feels safe and what feels like good connection. But you're totally right, where it has to be done in a way, especially if there's any history of trauma, abuse, that makes people feel that they cannot trust their internal system and that they don't have good intuition. And even sometimes when we give people a diagnosis, we can diagnose them with anxiety when it's is it anxiety and there's a pathology there, or is it something else? I often will see people be oh, I'm just an anxious person and that's why I feel this way, and the medication will solve it. And the medication can really help. But sometimes it's have you been through ways of relating that are not, you're just an anxious person, this is how you are and you're broken in the world. It's no, you have an ability over time to have experiences of secure relationships. It just takes some kind of redoing.
Yeah. And you're using the medication to treat this constant anxious response to a disorganized attachment.
Right.
Yeah. So I guess the way I view this, and I know everyone loves in medicine, we love to say lens, but it's really like that.
Yeah.
So when we're at the optometrist and I'm like, what looks better, 1 or 2? 1 or 2? Attachment theory is 1 and CBT is 2. We're really looking at the maladaptive core beliefs someone has, their concept of self, their personhood, and how they relate to other people. And we're just picking what focal length we want to look at it with.
Yes.
And some of it's captured well in attachment theory, some of it's captured well in CBT, some of it in psychodynamic. Yeah. And so the adept psychiatrist is someone who can, or psychologist can navigate those lenses well to find one that fits both their and their patient's understanding the best.
Right. And sometimes you're going to see the same thing in different lenses.
But I feel like a lot of time you do.
Right. I think a question for us to end on positively.
Actually, I have something I wanted to talk about, which
go
is I use these lenses and I applied them to movies that I had watched. And I think I gave you homework too to find some characters that you think show attachment styles.
Yes.
And how they play out.
Yes.
So why don't you go first? I want to see what you brought up.
Okay, so mine is Meg in Hercules and Hercules. So Meg in Hercules, as the Disney version, as those of you who know, has a song called I Won't Say I'm in Love. She's also like, for a number of reasons, a servant to Hades, and is trying to is supposed to go mess up Hercules and fool him and make him not a hero and da-da-da-da-da. And then accidentally falls in love with him and sings this song in the middle of the movie, if there's a price for rotten judgment, I guess I've already I've paid it, or if there's a prize for rotten judgment, I guess I've already won that. No man is worth the aggravation. That's ancient history, been there, done that. So first of all, bar. Second of all,
I think she might have been my first animated crush.
Wait, I thought you said you hadn't seen this movie.
No, I'm looking it up right now. I've seen this movie.
Yeah. So I would say that she's avoidant attachment.
Yeah, so no man's gonna hold her down.
Avoidant, and also no one's gonna be good. I will not be dependent on anyone. I will not need anyone. They're only gonna disappoint me. I've had this experience of no one being attuned to me and abandonment. I'm not doing this. That's my pick of okay.
I think it's a funny metaphor because the strongest male figure in her life is literally Hades.
It's literally
it's are other people safe or are other people evil? She's like, well, the only person I know is actually the devil.
Yeah.
Or the Greek. I mean, Hades isn't really the devil, but the Greek interpretation of the the overseer of the underworld. So sorry, Hades. I know he probably hates getting compared to.
Unfortunately, I think he was my first childhood crush.
All the time.
Sadly, what does that say about me?
Yeah, that's so funny. No, I can see that. Her being avoidant attachment. No, I wasn't picturing you having a crush on the animated version of Hades with the blue hair.
She's got a good personality. That's all I'll say.
Now I'm going to segue into what I brought to the table,
who are yours?
Which is, so first I'm going to do anxious attachment.
Okay.
And I have Jerry Smith from Rick and Morty. So
we're outside of my sphere of pop culture right now.
Okay, so I'd love to explain this to you. So Rick and Morty is a lovely show about interdimensional travel. So they actually probably started the whole interdimensional plot sequence that's been pretty overused at this point, but there's infinite number of realities, and Rick is this super genius who's the smartest in all versions, and he's the only person who's discovered a way to travel in between these universes. And he lives with his daughter and her lame duck husband Jerry, who cannot do anything on his own. He just he has to be stuck with either his scared son or his husband or his wife Beth, or with Rick and all this time. So it's kind of a running joke that Jerry can't do anything to support himself. And there's I think there's one time at the dinner table where he's toasting at Thanksgiving, and he's like, to my lovely family who I'm so grateful for, and if I didn't have you around, I think I would actually perish. And then it's like quiet for a second at the table. And he goes, at my own hand. I'm gonna be honest, like, Beth, if you left me, I think I might end my, and then it like just cuts off. And I was like, wow, that's great job, Rick and Morty. Like you identified some anxious attachment there.
Okay, I see it. Yeah, I see it.
and it's like funny how it plays out, but then like how we were talking, he gets the chance to redeem himself. And so there's a lot of times where he is abandoned, and then Jerry has to learn to depend on himself and have self-efficacy. So they leave him behind in this universe where basically it's like an apocalyptic end to Earth, in that dimension they left it. They come back years later, and Jerry has survived on his own. And he's like, I learned to depend on myself. He's like in all this caveman garb. He's got like a hide of a buffalo on, stoking a fire with a spear that he made himself.
Yeah.
He's like, that's old Jerry. Like new Jerry has secure attachment. He can do his own thing.
That's like your dream is like the movie.
Yeah, that's my redemption. Jerry has a great redemption arc.
Honestly, yeah, that does sound like good. Like he's getting secure.
Well, at least, so the problem is, then you go to the next episode and they're in a new dimension. We're back to lame duck Jerry. But that one Jerry in that one universe, kudos, man. Glad you did it.
That's how some people feel in therapy, though. Like they like reach a breakthrough and they like, or they have like one victory that week and they're like, look, and then it's like next week, new episode. We're back to the usual.
Yeah, exactly. So my second character, I just wanted to squeeze this in because I have a hot take on this, but is Goodwill Hunting. So Will Hunting is your classic avoidant attachment, but you could use an antisocial lens to view him as well if you wanted to. True. Because a lot of what he does makes almost no sense. Like Will's like, time to drive in my car. I'm this like super genius that can solve these math problems. I'm being hired by the university to solve math problems, and he's like, better get in a bar fight or start conflict for seemingly no reason. And I think when I first watched it, I was like, oh, doesn't make any sense. But he doesn't want to be in a situation where he's dependent on anyone.
Right.
And he almost, to like an absurd hyperbole, views himself as so great that he can get himself out of any kind of trouble, out of jail. Like he's talked himself off the stand several times at the start of the movie. And then every time he like finds himself getting close to the Stanford girl, I forget her name, or sorry, the Harvard girl who's going to med school at Stanford.
Yes.
He like pushes her away.
Yeah.
And the conclusion to the movie is he has to go see about a girl, and he kind of realizes that he can trust other people, kind of correct his attachment. So,
and then there are no issues ever. It's
everything's perfect. Yeah. So thanks, Ben Affleck, for creating this wonderful film. I don't like Good Will Hunting though. So I feel like I've been glazing it by kind of giving Will Hunting's character more nuance than he deserves. Because at the end of the day,
I like it.
I know, and we'll discuss this in a different episode.
It's going to be on the Patreon.
But it's Oscar bait that is essentially just 3 monologues from Robin Williams, and the rest of it is screen filler. So it works really well in these digestible bites. Watch it this weekend. We'll talk about it later.
I live it.
Okay. Thank you so much for listening. If you guys want to learn more, please reach out to our socials. You can contact us and give us any of your feedback, things that you want to see differently about the show, any of my jokes that landed, didn't land. If you want to hear Margaret talk more, if you want to hear me talk more, we're open to all those things. I know everyone kind of wants to have their voice heard, and our inbox is open. So this is a conversation we want to have with y'all. If you want to reach out on Instagram or TikTok, you can find us at Human Content Pods, or you can contact the team directly on our website, howtobepatientpod.com. And remember, this is a new show. It's an experiment for me and Margaret. We're trying our best to make this thing work for us, but also for you. You're the audience. You know? This is kind of a 3-way conversation. So if there's stuff that you want to hear in the conversation, please write in. We'd love to hear about it. Or if there are things that you're not comfortable with, or just anything you have feedback on, we want to hear it all.
We're learning how to be psychiatrists, and your guys' feedback on this is part of us becoming better at doing that.
Yeah, we need to have a secure relationship with the feedback we get from y'all. If you want to see full episodes, they're available on the YouTube channel each week at It's Presro. Thank you for listening. We're your hosts, Preston Roche and Margaret Duncan. Our executive producers are me, Preston Roche, also Margaret Duncan, Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brooke. Our editor and engineer is Tracy Barnett. Our music is by Omer Benzvi. If you want to learn about our program disclaimer or ethics policy, so to learn about our program disclaimer and ethics policy, submission verification and licensing terms, or HIPAA release terms, just go to our website and check out how to be patient at human-content.com and bring up any questions or concerns there. So just remember, we do this as learners, we do this as physicians in training, and as fellow humans that are just trying to bring these discussions to light. So we appreciate any feedback on it, but the goal is ultimately that this isn't medical advice, and that also we're not trying to stand on our pedestal and preach to you. Yeah, well, a little bit.
I am about Strega Nona, but that's neither here nor there.
and I will about Good Will Hunting. How to Be Patient is a human content production. Thank you guys for listening. Thank you for watching. If you want to see more of us, or if you want to see, this is Lilac, she's my cat. She's going to be waving her hand at one of the floating boxes, which will lead to more episodes. Lilac, point to the other episodes. Lilac doesn't know what the internet is, but I swear they're there. They probably exist for real. But in the meantime, I'm just going to pet Lilac, and then I'm going to go dance in the background.